On behalf of Joshi's Kerala Group, I am welcoming all to this classroom. And Dr. Love K Katarria is basically an allopath and he loves acupuncture very much. Now we can learn more from him. Good evening, sir. Welcome, sir. Now we can take care of. Thank you.
Good evening, everyone. Thank you, ma'am. So let's revise a bit. And so we have seen essence, we have seen chi, we have seen the functions of chi, various kinds of chi. We have seen the blood, the relationship between the essence and blood, chi and blood, how they affect each other. Now today we are going to study about another very important topic, that is body fluids. Okay, and in routine cases we see very common conditions due to some derangement or some problems with the physiology of body fluids. Yeah, so body fluids, as for TCM, they are known as Jin Ye in Chinese. So Jin is anything which is liquid, and Ye means the body, the fluids present in the body. So this is what we call it in Chinese. Now, in order to understand the TCM point of view, let's have a brief outlook how the body fluids and what's happening as far as the modern medicine is concerned. So fluids we are talking about, so definitely all the fluids and the food stuff, they ultimately come to stomach. So from the oral cavity, the food enters or the liquid enters the esophagus and then it enters the stomach. So from stomach, it goes to intestine. In intestine, what happens? First of all, it goes to small intestine. So in intestine, what happens in small intestine? There is the absorption of essential nutrients like carbohydrates, like glucose. It is being broken down further and refined into a simplified product, that is glucose. If it's carbohydrate, amino acid. If it's protein, it gets converted into amino acids, and if it's fats, it gets converted into fatty acids. So they get absorbed there. So that is the pure essence, the pure part of the fluids and the food. They get absorbed there, and the impure part is pushed to the large intestine. So large intestine has further the role of absorbing the excess water from the stools, so that only that amount of water is required, so that can be pushed out easily. Okay, if excess water is absorbed, it will lead to dry stools, and if there's too much of water is there, it will be a watery stool. So this is the concept we all know, and but this is a very limited part, because as far as the Chinese view is concerned, or the acupuncture view is concerned, it's a much broader view. So let's go to that chart. It's a big chart there, and I'll try to explain you each and every part of it. So as we saw that the stomach is known as the origin of all the fluids. Okay, because stomach is the very first organ to receive all the kind of foods and fluids. Okay, so that is the origin of all the fluids. So stomach is an organ which hates dryness. Okay, it loves the fluid part. So what happens? According to TCM, the stomach is responsible for the rottening and the ripening of the food and the body fluids. So from there, the uh, the fluids goes to small intestine, or the food goes to the small intestine, and there it is getting converted into chi. And from there, the body fluids. Now there are two parts again. One is pure, the other is impure. Okay, we have to segregate both of them. This is the whole and sole target of all the organs. You have to take out the good part and just remove the bad part. So the pure part, it goes to the pure part of not the chi. I'm talking about here only about the body fluids. So the pure part of the chi, body fluids, it goes to lungs. Okay. So lungs is like like a perfume spray. Okay, you have seen those cans, how it mists, create a mist, how it sprays. So lungs has a descending function, diffusing function. So in that diffusing function, that pure part of the body fluids is being diffused like a mist to the skin and muscles along with the defensive chi. So it has been diffused. So all kinds of the fluids like tears, saliva, found in the sweat, definitely. So these are also the part of lungs. The lungs try to diffuse it. Definitely, tears are being produced by liver. Okay, they're part of the wood element, but it's diffused by, okay, the diffusing function of is done by lungs. So this is how diffusing action is done. So, and this is the reason why upper burner, the upper warmer, is known as mist, due to this diffusing function of lungs. The other function of lungs is, we have already discussed that it sends the chi down to the kidneys, and a similar way, lungs also descends the body fluids, some part of the body fluids, to the kidneys, where the process is happening, and we'll be coming to it. So there in kidneys, what happens? It is further transforming it into pure and impure. Again, that pure part from the kidneys, okay? Again, the pure part from the kidneys, it goes like a stream towards the lungs. So why it sends it there? Because lungs has the dryness energy. So lungs like to be dry. So it should not, but it should not be too dry. Okay. So that's why some part of that pure fluid is being sent like a stream towards lungs by the kidneys. Then from the impure part of the body fluids from the kidneys moves towards the urinary bladder. We'll see it later. So now let's come back to the spleen and stomach part. Now from there, the pure part has gone to lungs, and the impure part moves to the small intestine. Now, as we have already seen the medical part of it, that small intestine has the function of segregating the pure and impure. The good part is taken, the bad part is given to the large intestine. So we can see that thing as well. So the pure part goes to the urinary bladder, okay, and the impure part goes to the large intestine. So the large intestine, now again, some is reabsorbed in the large intestine. That is how it's happening. We saw in the last slide, and rest is the purely impure part is the totally impure part is being removed like feces. Now let's come to the bladder. So bladder has received the pure part from the kidneys. It has received pure fluids from the small intestine. So they again segregate it. Okay, they also do some purification, and the pure part goes back to the lungs. Sorry, to the skin and muscles. So the sweating is also constituted by the bladder, and the impure part goes out as urine. So in all these, the bladder has a very important part uh, as far as TCM is concerned. So what it does is, so bladder requires how the bladder performs its function. It performs this function uh, because of the kidney yang or kidney chi with the help of that. Original yang is that. So all this process, because body fluids are yin, and to move the yin you need some yang. Okay, so that is being provided by kidney yang. So kidney yang heats up, it provides all kinds of energy for the transformation in the small intestine also, in the kidneys as well, and the bladder as well. Then kidney yang also provides its heats to the spleen, so that spleen yang can also, so the spleen can also perform its function. Okay, this is a very important topic, because yesterday we saw a case of ascites. Okay, then we saw the case of puffiness and the swelling, and I told you to do some moxa over there. This is the only reason why I told you to do some moxa, because lungs are not working properly. So in the upper part, if there is some problem, you first consider lungs, and the lower and the middle warmer, they are see, the middle warmer is designated to spleen. So spleen has a very important role in the body fluids. So in ascites we saw see, there is a ascites is a condition in which the visceral fluid or there is a lot of accumulation of fluid on in the abdomen, and it swell up like a balloon. So then if it's too much, then you have to tap out the excess water from there, from the abdomen. Okay, so it happens mostly in case of liver problems. Then the lower warmer is being controlled by the kidneys and the swelling in the legs, which is very common. So you have to purify the kidneys. Definitely, always in all the cases, we have to look at the spleen, of course, because it's the origin of all the things. Okay, so mainly lungs, spleen, and kidneys are involved in the body, all these body fluids part. But other organs are also play a major role. They also play a role, but the major role is played by these three principal organs. So let's read out. Body fluids originate from our food and drink, and these are transformed and separated by spleen. Some clean fluids then goes up from the spleen to the lungs, which spreads some of them to the skin, and some then of them down to the kidneys. So from the spleen, some dirty fluids go down to small intestine, where they are separated again, and this time into pure and impure. So following this second separation of pure fluids go to the bladder, and the impure fluids goes to the large intestine, where some water is reabsorbed. So bladder further transforms and separates the fluids it received into pure and impure. So the pure fluids flows upwards and goes to the exterior of the body, where they form sweat. The impure fluids flow downwards and are transformed into urine. So the bladder affects this transformation and separation by the power of chi, which it receives from kidney yang. So kidney yang, that's why is so important. Any kind of swelling, usually not after an injury, but apart from the injury, if you are getting some swelling, the fluids are getting accumulated. You need to work on that particular organ. You have to increase some yang part of it. So this is the reason why I told you to do moksha at the upper back in case of puffiness in the eyes, the swelling which was there. So lungs are going a bit weak there. So the pure fluids need to be transported upwards. Yeah, that's a very important part. Pure fluid should go up and then pure fluid should go downwards. And this correct movement of pure, and we yesterday we saw that ascending, descending, exiting and entering, that is known as chi mechanism. And that is again applied over here. As far as chi is concerned, it's very important. And similarly, if the body fluids are moving in their proper pattern, the body is in harmony, there is no disease. If it's not so, it may lead to various kind of problems. Many organs contribute to the transformation, transportation and excretion of body fluids, but primarily it's lungs, spleen and kidneys. So the pure fluids flows upwards to the lungs, which distributes some of the space under the skin, and that is why I've been saying that see at this we have been talking about, you've been asking about the sweating part so much. So sweating can be due to excess of heat. Okay, if there's too much heat inside the body, there will be excess of sweating. You feel too much hot. Okay, that could be one reason. But nowadays, I see most of the patients are having this issue due to lung deficiency. Lungs are definitely weak these days because of so much of pollution and bad lifestyle. So spontaneous sweating is a result of weak lungs. Okay, I have one of my uncle. Okay, he has a problem. It's a very typical issue. It's very interesting. What happens with him is he starts sweating as soon as he puts a bite in the mouth. As soon as, okay, that's very interesting. So the sweating comes out as soon as he starts eating something, and he sweats like a hell. Then, and that sweating happens only and only on the head, nowhere else. So very interesting case. I want you to you should put your heads why it's happening. Just let me know at the end of the session. So allopathy in modern medicine, there is no answer for that, but I've tried to solve it. So just let me know what do you think. So bladder function of yeah. So the pure fluids flows upwards to the lungs, which distribute some of the space under the skin and some down to the kidneys. For this reason, the lungs are called as the upper source of water. The bladder function of chi transformation is controlled by kidney, hence the kidneys are the lower source of water. And that is why the relationship between the lungs and kidneys is so important. They are controlling the respiration, they are controlling this body fluid part issue. So in case of asthma, in case of respiratory disorders, these are the two primary organs of concern. Okay, so that is why you feel so much breathlessness, or you can have some swelling of the upper part of the body. In case of thyroids, it happens. And similarly, the patient sweats a lot. So directly or indirectly, we have to treat the lungs. Okay, so points could be different, but the root is there to treat the lungs. So here is another diagram to show you the relationship with the internal organs of the body fluid. So spleen is the one which transforms and transports. Lungs diffuses the body fluids. Kidney, they transform, they separate, and then excrete as well. Bladder has no only function of excretion. Okay, then the triple burner also We'll also look them one by one. So spleen is very, very important because it's the place where the initial, the first stage of the process is happening. So it also controls the crucial direction of moving pure and impure. So this is very, very important. That's why spleen is such an important organ in case of body fluids pathology, because of its pushing pushing the body fluids and the chi up. Okay, this is a very, very important functions, and all the pure part, why it is going up, it's also due to the energy of spleen. Okay, so if spleen is deficient, a lot of big trouble is there. So for this reason, spleen is always treated in any type of disorders of body fluids. Now lungs. So lungs control the diffusing of the pure part of the body fluids coming from the spleen to the space under the skin. Now this is an aspect of lungs diffusing function, and they also send some of the fluids down to the kidneys and bladder, and this is the aspect of lungs descending function. Now because of these two functions, the lungs are said to regulate water passages. It's already clear. Now, kidney, they vaporize some of the fluids. I have told you, so they vaporize some of the fluids back to the lungs so that they moisten the lungs and they don't get too dry. So kidney yang is very important, and they control many stages of transformation of fluids. And it's helping in kidneys itself. It's helping in the small intestine. It's helping the spleen itself, because the deficiency of kidney yang nearly always results in the deficiency of spleen yang, because it's this is the main yang energy available. So if there is in long run, so it can start with like you are having kidney yang deficiency, and in the long run it will lead to spleen yang deficiency, or you are having the spleen yang deficiency initially. So in a long run, kidney yang deficiency can happen. Both can happen. It can happen either way. So they assist the small intestine is the function of separation of body fluids into pure and impure parts. So small intestine is again dependent on kidney yang. So they provide chi to the bladder for its function of chi transformation. And triple burner is also receiving the energy from kidney yang. Now let's see small intestine. The small intestine has the function of separating the fluids received from the stomach into clean part, which goes to the bladder for the excretion as urine, and dirty part which goes to the large intestine, especially for reabsorption and partially for excretion in the stools. So small intestine function of separating fluids is controlled by the action of kidney yang, which provides, we have already seen this thing. Bladder is again, it again transforms into pure and impure. The impure goes down as urine, and this is the energy received from the kidney yang. Triple burner assists the transformation, transportation, and excretion of fluids at all stages. The upper burner assists the spleen in directing the pure fluids. So it's being assisted by the upper burner, the triple burner, and the lungs in dispersing them to the space under the skin. So for this reason, upper burner is compared with a mist. So upper burner is considered as mist only and only due to the diffusing action of lungs. So middle burner assists the stomach. So there are three burners. The upper burner is assisting lungs, the middle burner is assisting the stomach and the spleen. And for this reason, the middle burner is compared with a muddy pool. Okay, and the lower burner assists the small intestine, bladder, and kidneys in their function of transforming, separating, and excreting fluids. For this reason, lower burner is compared with the draining ditch. So all the impure fluids are going down, and it's known as drainage ditch. Now, stomach is very, very important. So stomach is the source of the body fluids, and because the fluids first enter the stomach and all the processes are happening. And as I told you, stomach likes to be relatively moist. It hates dryness. So any kind of dry food. See, it's very interesting to know that usually in TCM the syndromes are like stomach yin deficiency and spleen yang deficiency. I was so much when I was studying, I was so much confused why there is not stomach yang deficiency, why it's stomach yin deficiency. So here we got the answer. And why there is spleen yang deficiency? Spleen yin deficiency is also there, but it's not very frequent. Okay, so the answer is this: the stomach is the one which likes to be wet. It's don't like to get it's don't like its dryness. So any dry food, if you are having like we eat some papads, it's very dry. It's bad for the stomach. So whenever you eat some dry foods like that, we have to take some liquids along with that. Keep just remember when you eat some poha, just try to have some. Poha is also very dry, so try to have some kind of liquid stuff. So those people who has weak stomach, the problems of acidity and weak stomach. So after eating these kind of dry foods, the acidity increases or some verbs will be there, something will be happening. It's only due to the food they eat. Okay, so just take care of that. And the spleen on the other side, it hates dryness. It's like it's like dryness. It hates to be the wet, the humidity. It don't like humid. Don't like to be humid. So there is a very contrasting to have. That's why you need to have a very balanced food. So if the dryness happens too much in the stomach, it can lead to stomach yin deficiency, and this we can come across in cases of I've seen cases of peptic ulcer. We have seen them. It's not only peptic ulcer is not only due to stomach yin deficiency, but long run stomach yin deficiency develop. So for this reason, wet sickly foods are beneficial to the stomach, and excess of very dry foods such as foods roasted or boiled for a long time may damage stomach yin. So we have seen that two types of body fluids are there. The fluids in Chinese is called Jin and liquids in Chinese are called Ye. We have already seen that. So fluids like the thin, what is Jin? So Jin, let's understand. So the thin, clear, light water. So because it is light, so it will move with defensive chi. As I told, the soldiers should be, they should not have a big abdomen. They should be thin. They should be swift. So defensive chi should be light. It should be swiftly moving throughout the body. And similarly, the fluids, they need fluids along with them. So the fluids also should be very light and thin, and it moves with the defensive chi on the exterior, and they are under the control of lungs, and which spread them to the skin all over the body, and of the upper bunda, which controls their transformation and movement towards skin. Now their function is to moisten and in part to nourish skin and muscles, to keep them moist, and exuded as sweat, very important, and these also manifest as tears, saliva and mucus. So all these are all very light kind of fluids, and it becomes a component of fluid part of blood. So they always so what is the very important, this is another very important function. So blood so body fluids can get into blood, making it light. So it's this Jin part of the body fluids which is very light. So they move to the blood, making it lighter so that it can move swiftly, which prevents its stasis. Now the Yi part, the liquids, and these are the heavy and dense. So if it's heavy, the other chi which we saw was nutritive chi, so it will be moving with the nutritive chi which flows in the interior of the body, and it is being controlled by spleen and kidneys. for their transformation, and of the middle and the lower burner for their movement and excretion. So their fluid function is to moisten the joints, spine, brain, and bone marrow. You can see they are also performing very important functions. They also lubricate the orifices of sense organs, eyes, ears, nose, and mouth. So accordingly, you have to see in the patient that what kinds of symptoms they are having, and is the diet is proper, are they taking a proper balanced diet along with the fluids, and then you have to make a decision. So suppose in case of constipation, say if you ask me about some points, so I'll say there are multiple factors for it. Okay, so the most important factor itself, the water is itself. Okay, the fluids itself. So if water is lacking in the body and the patient is not drinking enough water, suppose I come across patients which hardly drink even a liter of water, and they are having so much of constipation. So now needling is not going to do anything. Okay, you have to understand the root cause first. So the first thing is to increase the water intake in the patient, and then you perform the needling or you take the points accordingly. So everything has its own role, and it should be kept in mind while making a proper diagnosis. So now we see the relationship between the chi and body fluids. Now chi has a function of transformation and transportation of body fluids, as we have seen the kidney chi or kidney yang is doing that. The chi also holds the body fluids and the blood we saw yesterday. So the body fluids, like in leukorrhea, what happens? The kidney is not able to hold the body fluids, and that is why the leukorrhea is happening. Or the spleen is not able to hold it, and that is why the leukorrhea is happening. This could be one of the reasons. Now, in turn, body fluids nourish the chi, but that function is not a big. That's not a big function. Very significant. So chi transforms and transports fluids. Without transforming and transporting power of chi, body fluids would accumulate and give rise to disease. So what's happening in case of spleen yang deficiency? There will be swelling. What's happening in case of kidney yang deficiency? There could be swelling in the legs, and the yang energy is unable to move the fluids, and which is leading to the edema. So chi also holds in body fluids in the same way as it holds blood. So if chi is deficient, fluids may leak out and give rise to urinary incontinence. So urinary bladder, again, if it's if the chi is weak, the kidney chi is weak, or its own chi is weak, it's not able to hold it. So spontaneous that happens mostly in case of either children or the elderly patient. So mostly in elderly patients it can happen. Then you can also see that spontaneous sweating, so it could be deficiency of lung chi, and chronic vaginal discharges in case it's due to deficiency of spleen chi. While chi produces body fluids, these on the other hand play a minor role, I have already told. A deficiency of spleen and stomach may in long run cause deficiency of fluids. Sorry. Also, after a significant, so this is another very important aspect, how each and everything is affecting, every vital substance is affecting the other one. So if there is a significant loss of fluids, okay, what happens during the excessive or heavy sweating, so chi also becomes deficient, and the person may suffer from cold. So the symptoms will be of yang deficiency or chi deficiency. So chi may also be consumed by excessive vomiting. So the patient who are having a vomiting like 4 to 5 or 6 times. I had a patient last week who was vomiting like for past 2 days. Look at the condition. His body was depleted. The chi was totally depleted. So he was unable to eat anything. Okay, so vomiting was too much. So he was presented to me. So ultimately what we had to do, I had put some acupuncture, so he was able to, the vomiting stopped, but the chi was so less, so ultimately I had to put some drip, okay, some drip to him so that some body fluids are back. You can also see the excess sweating as far as the medical side is concerned. So excess sweating, what happens, there is a loss of water along with the loss of salts. So if they both get out of the body too much and you are not consuming them, that ultimately leads to deficiency of the salts and water, and that leads ultimately to dehydration in the body, which is again a kind of chi deficiency of symptoms will be there. The fluids that form sweat in the space between skin and muscles are blended with defensive chi, and profuse sweating also causes a loss of defensive chi. So because defensive chi is also controlled by lungs, okay, so if there is too much of sweating happening, ultimately there will be loss of defensive chi because the lungs chi is also getting deficient. So since defensive chi pertains to yang, it is said in Chinese medicine that profuse sweating injures yang. On the other hand, if chi is deficient, fluids may leak out in form of sweat. So again, it's important. So it's both the ways. If you see a patient having excessive of sweating initially can show the signs of chi deficiency. On the other hand, if the patient is having chi deficiency initially, like that of lung chi deficiency, it can lead to the excessive sweating, so spontaneous sweating which is happening. Okay, so it can happen both the ways. You have to find out the root cause, and that is why I'm always saying that it's not that easy to just PCM is like you're very, very specific. You have to find out why it's happening. So if you get the reason for why, the treatment is such fantastic that you'll get some results like a miracle. And this is the beauty of the PCM. So the relationship between blood and body fluids. Now blood nourishes and supplements the body fluids, and it's also does the same thing. So body fluids constantly replenish blood and make it thinner so that it does not coagulate or stagnate. So you must have seen those patients. At least I have seen in my practice. A patient come with, sir, I'm on BP pills since so and so time. My first question is, how much water do you drink? So the answer usually, I've seen those patients. So the answer is, I drink hardly a liter of water, 2 to 3 glasses. So you eat any medicine, you do anything, you do any acupuncture, you do any mudra, you do any sujo, nothing is going to work. By the fluid, your body is lacking the body fluids. The heart has to pump more. Okay, the body fluids is lacking, is deficient in the body. The blood is getting thicker. Now what heart has to do? It has to pump harder. Now it has to pump harder. The blood pressure will go high. So in this case, something wrong will happen until and unless patient consumes more water. Okay. So that is why water is such an important component in our diet. We need to be hydrated. That is why water is such an important thing, and that is why yesterday we also saw why oxygen or why breathing is such an important thing, because it helps the heart. We recently saw a case. Let me discuss with you a very important part. And most of it must come to your mind that a very famous actor just demised a few days back, 2 to 3 days back. His name was Siddharth Shukla. Now, a person like him who is like diet conscious, they keep dietitians all time along with them, and then then there is too much of physical workout is there. And still there is a heart attack we see. So if the person like them, if they are getting heart attacks, what about us? We don't do all kind of such heavy physical exercises. See, as far as TCM or acupuncture is concerned, see the theory that heart is affected only by the cholesterol or only by, and you will be escaped out of the heart diseases uh, just by doing some exercise or physical workout. Let me tell you, this is the half portion. Definitely that is required. Okay, you need to do some workout, or you need to do some yoga, or you need to do some kind of physical workout. Definitely that is required. Uh, but this is only half picture. The other part of it is stress. Okay, because according to TCM, the heart is affected by mind. The heart controls the mind. So if mind is affected, the heart will be affected. And TCM very clearly explains the reason why there is uh, these heart attacks or happening in such a young age, even after uh, having such a balanced diet and a proper workout session as well, and still their heart attacks. The only reason is they are not working on their mind. So we need to work on the mind as well, and that could be, I don't know the whole history, but that could be the reason what I see it from my side. Okay, so it's totally my view. I have just presented the facts with you. It looks to me very sound. The facts look to be very strong to me, and that's why I tried to present it with you, because a patient just asked me why it happened. The patient which come to my clinic, they just ask me why अभी exercise करने भी रहे हैं, डाइट भी अच्छी ले रहे हैं, इतना पैसा है, सब कुछ खर्च करते हैं, and still the person is getting heart attack. So it's somewhere related to stress. So blood can also nourish and supplement body fluids. Both blood and body fluids pertain to yin and are somewhat interchangeable. For this reason, if there is a significant loss of body fluids over a long period of time, as in chronic spontaneous sweating or excessive use of sauna, this can lead to deficiency of blood, but that happens in the chronic cases. Vice versa, if there is a chronic loss of blood, as in menorrhagia, so this can lead to deficiency of body fluids and dryness. So this is how blood deficiency leads to dryness. Blood has a nourishing function. Some way or the other, this thing is helping. The body fluids are they are keep on interchanging uh, their roles. So the body fluids goes to the blood and nourishes the blood, and this is all what happening. So because blood and body fluids come from the same source and mutually nourish each other, sweating and bleeding treatment methods are contradictory in practice and should never be used together. So some patient who has gone immense bleeding or blood loss, we should not try to induce any kind of sweating in that patient, because ultimately it's going to affect the patient's health, because we have seen they have the relationship blood and body fluids. So also if the patient is bleeding, one should not induce sweating, while if the patient is sweating, bleeding as a treatment method is contraindicated. So both the ways it is there. So what is the pathology? So pathology, it could be either due to deficiency of body fluids. So main part of the body fluids is being taken care by the water itself. So it should be in sufficient quantity. If there is deficiency, I have already given you the examples what can happen. Now accumulation of body fluids in the form of edema. So that can happen due to deficiency of spleen, lungs, and kidney, and there could be dampness or phlegm creation in the body. We are not going into much detail of the pathology. Now we'll be looking at the last of the vital substances, and these days mind has a very major role to play because of the lifestyle and the stress which is increasing day by day in our lives. So mind is the most subtle and non-material type of chi. So this is the most rarest rarefied form of chi, and it is always the yang. So mind is always there in the top of the head. Nobody has the mind in their legs. Okay, so that is why it's the yang. It's the most yang in the body. So the essence is the origin and biological basis of mind. We saw in the topic, essence topic, we saw that mind is nourished by essence, and if the genetic material is lacking that strength, so there could be the cases of mental retardation, like that we see in cerebral palsy. The mind of newly conceived being comes from the prenatal essence of its mother and father. So again, essences are required. And after birth, it's the prenatal essence which is stored in the kidney. We have already discussed that, and this provides the biological foundation of mind. So my life and mind of a newborn baby, however, also depends on the nourishment. So definitely depends on the nourishment. So a child is born with a very strong essence, and if you are not feeding him properly during the growth years, and if they are not getting enough nutrition, definitely their mind and the body both are going to be affected. So the close integration of body and mind, which is highlighted by the integration of, we have seen these three treasures. Okay, essence at the bottom, chi in the middle, produced by spleen. So essence linked to kidneys at the bottom, and mind to the heart at the top. These are the bases of the body. So the activity of the mind relies on the essence and chi as its fundamental basis. So it's not only the essence, it's also the chi. So if you are not having enough chi, you will be the mind will be affected, and the symptoms like depression, stress, anxiety, those kinds of the symptoms will start coming up. So this relationship of essence and chi and the mind is also a two-way relationship. Suppose if some patient is having a weak stomach or a weak spleen, so there will be a deficiency in chi. So what kind of symptoms will be there? The patient will feel lethargic, will feel lazy, okay, and it's for sure that they won't be able to concentrate and they won't be able to focus. So focus and concentration are the functions of mind. We'll see later today all the functions. So that will be affected. And on the contrary, if we see, if everything is fine, okay, in the body, the stomach and spleen are strong enough, now that person has a tendency of chi stagnation. Okay, so that can also lead to some problem with the. So first of all, the stomach will be affected if there is a chi stagnation. Liver chi stagnates. This is the first thing to get stagnate. This is the most common thing. And in long run, it can attack the spleen, it can attack the stomach, it can attack the intestine, and a variety of symptoms can occur. So in case of mostly, I'm telling you why I'm saying, because the IT professionals I have been in touch with, most of my patients are IT professionals as well. So we see that the symptoms they see, they are most frequent with inflammatory bowel syndrome, IBS. It's very common in them. The only reason is that they think a lot. They don't work. The physical work is too less. The mental stress is too high. So all the IBS mostly comes from the anxiety, stress, and all those things. And here we have to work on the stomach as well as spleen as well as heart and mind. Okay, so just working on the stomach part is insufficient, because that will be a half treatment only. I have some patients coming to me that they have been through all kind of Ayurveda. I'm not saying Ayurveda don't have the treatment, but what they come to me is after all kind of treatments they visit me, and Ultimately, what I saw, everybody is focusing on their stomach. Nobody focus on their heart or the mind. Okay, so what I try to do is definitely we work on stomach and liver and spleen, but we also work on the mind. So mind should be relaxed. How to calm it down. How to avoid anxiety. Just some concert. No, you have to work on the mind. Only consultation won't have it. It will be a supplement to it. Okay, because IBS is such a condition. A patient is fed up with the usually. The digestion is such a poor in these cases in a chronic disease. So that ultimately affects the mind. Okay, so mind is affecting the stomach, and in long run, when chi is lost, so again it is going to affect the mind. So it's a vicious circle. And IBS is such a problem which is very common days. You should always focus on working on the mind. We have a wonderful treatment for that. We get very good, very quick and very sustained result. The patient is following what we are suggesting. So if the essence and chi are depleted, the mind will suffer and may become unhappy, depressed, anxious, or clouded. If mind is disturbed by emotional stress, becoming unhappy, depressed, anxious, or unstable, it will definitely affect chi and all the essence. So initially it affects chi, and in the long run, it is going to affect the essence, because chi is unable to ultimately chi will be affected, then blood will be affected, and then the essence will also get affected in the long run. So in most cases, it will affect chi first, since all the emotional stress upsets the normal functioning of chi. Emotional stress will tend to weaken the essence, either when it is combined with overwork, yes, very important factor these days, and or excessive sexual activity, or when the fire generated by long-term emotional tensions injures yin and essence. So as far as yin yang is concerned, stress is always like yang part. Okay, so when yang remains more, it is going to damage the yin part. Too much of heat is going to dry up the fluids, and yin and the essence, or all they will be affected. So mind is most closely related to heart, which is said to be the mind's residence, and that's why we need to treat the pericardium and heart in such cases. So let's come to the functions. So functions of mind are consciousness, thinking, memory, insight, cognition, sleep, intelligence, wisdom, ideas, affections, feelings, and senses. So these are such a big list of what mind performs, functions, and we'll go one by one. So let's see, what is consciousness. So consciousness is basically who you are and what the totality of thoughts. So consciousness, let me tell you, is available only with the human beings, not with any other animal on the planet. So it's the totality of the thought how we are able to think, how the thoughts are coming to our head. So that is all, the mind is all responsible for that. And this is a the most important characteristic of mind. Okay, so mind residing in the heart is what makes us conscious as human beings, and what gives each of us a sense of being an individual. So you can also compare all those with the Ayurveda. You must be aware of that ego part study. So ego is also provided by it comes under the consciousness part of the mind. So in psychological terms, we may compare the mind with the ego consciousness. So who you are, okay, so that is what the animals does not have, or the plants does not have, or the bacteria, virus does not have that thing. It's only the human beings are blessed with this. So the mind is responsible for the recognition of thoughts, perceptions, and feelings. So when mind is clear, we are conscious. If mind is obfuscated or suddenly depleted, we lose consciousness. So this consciousness is also we are talking of that consciousness. Someone is getting fainted, so they lose consciousness. We are talking in both the terms. So if mind is strong, okay, so just now I discussed about the fainting part. So fainting, let me tell you, is sudden fainting. What happens is mostly happens due to poor supply of blood in the brain. Okay, suddenly uh, uh, some people with don't some children with poor stomach function, don't who those who don't eat in the morning. And in the assembly, I used to I just remember in my school days, so few the schoolmates, they just collapse if the session goes, the prayer, the morning session goes a bit longer. So that is known as syncope. Okay, so suddenly you faint, that is known as syncope medically. Okay, suddenly a patient fails. So that happens due to there is a decreased supply of blood supply to the brain. And because there is a decreased supply into to the brain, so suddenly the consciousness is lost. And that is how heart is related to, we can see that from the medical perspective. This is how we can link it. So let's come to the thinking part. So thinking will be very strong and clear if your mind is strong. Thinking part is, again, mind to be strong. There has to be a good essence. There has to be good chi. There has to be good amount of blood supply. So those patients with a heart blood deficiency will not be able to think very clearly. So all those people where their thinking function, they do a lot of thinking, because these days all the kind of professions, they require a lot of uh, use of your mind and brains. So if you want to improve your mental skills, definitely acupuncture or these allied sciences have a big part to play, because somehow they are going to affect your mind. Any pill in the world cannot, especially allopathic pill, they cannot work on mind. They work on brain. They don't work on mind. There's no concept of mind in allopathy. Okay, so and we have a very good treatment for that. So those who want to work, they can definitely try acupuncture. And if mind is weak or disturbed, thinking will be slow and dull. And we see in case of spleen chi deficiency or yang spleen yang deficiency, kidney yang deficiency, the patient typically presents with such symptoms. Now memory has two different meanings. First of all, it is the capacity to learn, okay, like some studying work or memorizing. The other is to remember the past events. Now these both of them, see, memorizing is one thing, and it is mainly affected by, definitely by heart, but it is also affected by spleen. Okay. Now, to remember, the ability to remember the past events, again, we divide it into two parts: the short-term memory and the long-term memory. That will be a big topic to discuss. But heart and kidney here has a big role to play. So both of these depends on minds, and therefore heart, although also on spleen and kidneys. So insight. So what is insight? Is your, how much you know about yourself, how much you can introspect yourself, the self knowledge and the self recognition, who you are, what kind of person you are, what you know, how much you know about yourself. These all insight is again provided by the mind. So you must have seen those people. They are least bothered or least aware of themselves. Uh, I have a patient, I think I discussed on the day one. I have a patient coming from for the breast tumor. Okay, she's 19 years old, and we have started getting good results. On it's been 5 6 days itself. So the root cause of her was the mind itself. Okay, what on taking the history, I came to know that she has a 4 centimeter diameter of, there's a big one, the big tumor is there. And she didn't come to know about it. See, 4 centimeters is such a big size. And it's very interesting that the patient is not aware of the fact that she is having a tumor. She comes to know when it becomes 4 centimeters in size. Now, this clearly shows that there is some problem with the patient's focus on herself and on her body, because on further taking the history, we come to know that she is too much emotional. Okay. Now, a person who is too emotional is going to be affected. The heart is definitely going to be affected, and ultimately, why I'm saying this, because the patient came to know about the tumor when it becomes 4 centimeter diameter in size. That's a big size. So she is least aware of what's happening in the body. That clearly show how much the mind is affected. And that is why I'm also giving the treatment. Definitely we have to treat for the tumor itself, but we have to treat the heart as well. And as soon as we treated the heart, okay, the points related to heart, and the period started, because she also had a history of delayed periods, a very delayed period, 15 days, 17 days. This time was 70 days late. Okay, 1 month. So the heart also has a function. I'm just adding a bit point. Also has a function of taking the chi down to the uterus. Okay, so those females, those who are in stress too much, so this could be one of the possible factors for your period, for your disturbed periods. Okay, so this is a very interesting case, and that's why I shared it. It's a very typical case of how heart can it can lead to tumors. Okay, it's not only the liver or the spleen or kidneys. So insight is lost uh, when the mind is obstructed by phlegm. So what phlegm is very sticky, so they are not allowing the chi to flow properly or blood to flow properly, and that causes the minds to obstruct and leads to serious mental illness like psychosis. Now, cognition is definitely a very higher mental process, like memory, language, problem solving, and abstract thinking. So in order to clear your mind, you should focus on your heart as well. All the things they affect the heart. So sleep. Now, definitely sleep is a very important part. And most of the patients, insomnia, delayed sleep, that they go to sleep very late, or a dreamful sleep, or a bad dream is there. So there also, the sleep is directly related to heart, and if the mind is calm, the person sleeps well without dreams. And even if they sleep less, they feel fresh after they get up. But if the mind is restless, the person sleep badly. So those patients who are taking pills, the brain goes slow. It's not the mind which the pill is working, and that is why even after taking 2 pills or 3 pills, patient is unable to sleep properly, and soundless sleep is not there. So we have to treat the heart and pericardium there, and we definitely have to see the root cause. Intelligence. So depends on heart and the mind. A strong heart and mind will make a person intelligent, right? A weak heart and mind will render a person slow and dull. It should be remembered, however, that the essence and therefore hereditary plays an important role in determining person's intelligence. Yes, hereditary has a big role to play, but it's not the only hereditary. You are hardworking enough. You can improve your intelligence. It's not a big deal. Wisdom. So that also derives from a strong heart. So how you are able to apply your knowledge, how you are perceiving the knowledge. See, I'm speaking the same thing, and you are all are listening the same thing. But every one of you, each one of you, will be able to understand and take the things in a different way depending on your knowledge and wisdom. So this is what is also affected by heart. So ideas are another function of mind, and the heart and mind are responsible for our ideas, our projects, and the dreams that gives our lives purpose. So, but this thing is also affected by ethereal soul. So now ethereal soul is another part, is a big topic again. But let me give you a short hint that it is controlled by liver. So ethereal soul has a different role to play. Now, which idea to choose, which idea to leave, okay, that is done by ethereal soul. Mind has the property of giving idea. It will give this idea, that idea, so much of idea. But which ideas to choose is done by ethereal soul. So without ideas, these all functions which we are discussing now, you can clearly see in those patients. I usually take a very detailed history, so I come to know that all these things, a patient with no idea what to do, how to do, a very lazy kind of patient will be there, who is least concerned what to do, and if you ask him, do you kuch idea nahi aata usko, okay. So dull patients, those are dull patients usually, or some patient with some mental diseases or mental retardation. They are not able to think that way. They don't know what to do next. Okay, so all those kinds of issues again are controlled by heart, but it's not only the heart which is affected. Other organs may also be affected along with the heart. Affections depends on the mind, as only the mind can feel them. So this is a very, very important function. See, sense organs and this affection. Okay. So heart is the only thing which can feel all kind of emotions and affections. Okay. Affections, emotions definitely affect all the other organs too. But it is only the mind which recognizes them. For example, liver has the emotion of anger. So liver will be affected by anger, but you are getting angry. Okay, you are getting angry. Who will tell you? It is the mind which is going to tell you that you are going angry. Okay. Sadness and grief will affect the lungs, but you are getting sad. How you will come to know? That will be told by your mind. All the emotions ultimately, whether it's anger or it's sadness, grief, melancholy, that is ultimately all the emotions are felt by heart. Only the heart can feel it because it houses the mind, which is responsible for insight. It is for this reason that all emotions eventually affect the heart, and it is in this sense the heart is the emperor of all the other organs. So feelings depends on the mind, as it is the mind that recognizes the stimuli generated by perceptions. Touch, taste, I told you all the sense organs. So you are able to feel anything, or you are able to have a smell and this temperature, pressure, or everything. It's only due to mind. Although touch is related to skin, okay, and skin is linked to lungs. So senses are, and sense organs also rely on mind. Each sense organ is related to a certain organ, and we know about it: the smell to lungs, and taste to spleen, and heart. So, however, all the sense organs rely on the heart because it is the mind that ultimately receives sensory perceptions. The eyes and the sight are obviously related to liver, especially liver blood and ethereal soul. However, the eyes rely on the nourishment from the liver blood. The blood flows to the eyes through the blood vessels, which are under the control of heart. So this is how, and that is why I've been saying again and again that we have to see the root cause. It's not only the liver which will be affected in case of eyes. You have to see the other symptoms, the tongue diagnosis, the pulse diagnosis, and then you will come to make a proper diagnosis of what exactly is happening and what is exactly the root cause. So thus, if the heart is strong and the mind healthy, a person can think clearly, the memory is good, consciousness and insight are sharp, the cognition is clear, sleep is sound, intelligence is bright, actions show wisdom, ideas flow easily. If the heart is affected and mind weak or disturbed, a person is unable to think clearly, mind is poor, consciousness is clouded, insight is poor, sleep is restless, intelligence is lacking, actions are unwise and ideas are muddled. So, in a nutshell, what I would like to end up the session here. But what I would like to how to take this all these sessions which I taught you, I shared the knowledge with you. How to look at them? See, first of all, uh, each and every vital substance. Okay, there is a two-way traffic, two-way process is always there. So if chi is affected, it can lead to blood. Okay, the blood can also be affected. If chi is affected, the body fluids can also be affected. If chi is affected, it can lead to the mind can be affected. On the contrary, if mind is affected, chi could be affected, blood movement could be affected. Okay, so there is a two-way. You need to be open. It's a very dynamic process which is happening in our body. Nothing is like if this is happening, so this will happen. You have to see in both the ways. You have to find the root cause. You need to now history taking is an art. You should practice it if you are planning to practice some TCM stuff. You need to know how to take a history. That is an art. So the more history you can, the better way. If you can take a history, the more symptoms you can take from the patients, and better there will be easier for you to understand. The patient is not going to tell you, I'm having loose stools, I'm having a semi stool. Okay, it's you approved. So the vital substance has these mind is again going to affect the stomach. The stomach can also affect the mind. So it's a two-way process. It's a dynamic process. So I'll end my session here, and I would I would like to hear your questions now.
Yes, Panma. Yes, Denia, you can ask question.
Yes, sir. Sir, you told that if the mind is strong, thinking will be slow. But actually, the persons who is having weak mind, they will be having more and more negative things. No?
What I saying, I have told that if the mind is strong, the thinking will be clear. Okay. So yes, you can take that. If the mind is weak, there could be see there are two meanings of this white. One is definitely there could be a negative thinking. Okay, and the other could be the mental retardation. That is also one of the meanings of weak minds. So it could be both of the things.
Okay, sir. Thank you.
Kaushal.
Yeah, hello, doctor. That was a wonderful session. I have two questions. First of all, where are you based? Which city? And secondly, which city?
I'm placed in Kanpur right now.
Kanpur.
Yeah.
Okay. Doctor, you were talking about the heart being weak and the mind, they have a direct connection. So if the person has all these symptoms because of maybe, like some kind of a grief or some kind of something, which has led to all these things, then how do you cure this? That's my question.
See, definitely you need to have some counseling. You need to give some time in counseling. But counseling, see, is not the only thing which will benefit. Okay, the person in such a state is least bothered. No, is not going to listen to you. So first of all, what I try, if they are not going to listen. See, suppose you are, आपके दिमाग में टेंशन भरी हुई है, आप नहीं सुनोगे. Okay, you go to any the psychologist and all that. The patient come to me. Okay. I have been to so and so psychologist. Doesn't work that way. So counselor se mil ke aaye. So what happens is, what I do is I try to figure out that why it's happening. What is the root cause of it? So definitely somewhere or the other, the heart and pericardium is affected. So first of all, I try to balance the heart and pericardium. This is the first way to approach. And as soon as the patient is relaxed, okay. The other thing is then the patient starts listening to you, because unless and until you are doing something to him and he is not feeling relaxed, okay, don't take it otherwise. See, at this time, what I have found, this is what I have found. Don't take it personally, any one of you. I'm not criticizing anything. Any kind of pranayama, any kind of mudra is not going to help it. Okay. For such patients, only for such patients, because that patient is in a different frame of mind, is in a different field, different world altogether. So first of all, you have to pull him to this world. You have to take him out of his mind. Okay. So what we do is we treat the heart and pericardium, we balance it, and then you can add these kind of therapies like mudras, the deep breathing exercises or pranayams. And then the counseling sessions are going to, because then only then he is going to listen to you. Or you can put some sujok as well. Okay, so sujok has a very good results in these kinds of treatments. But still, if sujok is also not working, just try with acupuncture. There's wonderful results. I am sharing again a case with you. Now this patient is a very good. He's in IT BHU, a very reputed college. Is studying engineering, and it's not an easy thing to get admission in IT BHU, let me tell you. So he must be having a very sharp brain. But what kind of problem he came to me with is he's having headache from past 1 year, and it's a sustained headache. So he went to BHU, and BHU, which is very reputed hospital, they told him that it's migraine. Okay. Now, unfortunately, anywhere in the world, there is no treatment of migraine in modern medicine. So he was, then he went to some Ayurvedic practitioner in Banaras itself. So what I found is he was working on his stomach. Definitely stomach is affected. Definitely it's affected. So from the day one, what I saw him, he was totally, there was no focus at all. He was so much in pain. He was so much, he was not able to focus at all on what I am saying. So I didn't just focus on just counseling part. I just stopped it, and I straight away and settled his pain and his mind. Settled it. Now today is, I think, the 5th or 6th day of his sitting. Now he looked at me more focused. Then I asked him to do some deep breathing exercises when his pain subsided, and he has started. Now he has started listening to me. Okay, so this should be a step-by-step process, and this is where acupuncture really has an edge.
And doctor, one more question I have. If supposedly there's a child, who's let's say an 8-year-old child or a 9-year-old child, they have extreme stubborn, if बहुत ही ज़्यादा जिद्दी होते हैं ना कुछ बच्चे जो बिल्कुल नहीं सुनते. So do all these mental frameworks also can be treated by all these things? Is there a reason behind it? कि इतनी extreme जब किसी की जिद होती है तो उसके पीछे भी कोई reason होता है क्या डॉक्टर?
Yes, there is always a reason behind all the things in this world. There's nothing without a reason.
But do we have a cure for that? Is my question.
See, it depends on what kind of जिद he is having. क्या जिद कर रहा है? It depends. मेरे को सक्सेस चाहिए किसी भी कीमत पे.
It's not a positive zid. It is a negative zid ki jo just defying everybody and just not listening, just completely not listening, and what I think is right, what you are telling me is wrong. I will not do what you tell me. Is that kind of a zid?
थोड़ा सा टफ केस होता है. It's not that easy. It's not that easy to deal with such cases. Definitely आपको इसमें पता क्या करना पड़ेगा. थोड़ा सा माइंड पे ही काम करना पड़ेगा. You have to balance the mind first of all. Okay, so that the person is ready to listen to you. Otherwise वो सुनेगा ही नहीं. वो अपनी एक लेवल पे है. Okay, you have to get into his mind itself कि वो कहाँ तक सोच रहा है. How is thinking? What's going in his head? So first of all, जो इतनी high frequency पे जो उसका mind चल रहा है ना, you have to bring that frequency down. So you have to somewhat sedate the mind. Okay. So after and only after that, then you need to have some counseling, a positive way to approach. This is only you can try. I'm not saying this will work, but this is the only way you can approach. Unless until ना जो भी patient है ना, वो एक higher frequency पे रहता है. इस तरह के जितने भी लोग रहते हैं, और ये बड़ी common problem है आजकल. It's very common these days. So आपको पहले तो उसका mind थोड़ा सा ना शांत करना पड़ेगा. अब उसके लिए आप रेकी करवाओ, एक्यूपंक्चर करो, सुजोग करो, डू व्हाटएवर फील्स यू बेस्ट. सो अ टाइम विल कम ग्रेजुअली दैट अ पर्सन विल स्टार्ट लिसनिंग टू यू. You can try this way.
Okay, doctor. Thank you so much. And if you can post your contact number in the chat, then we can contact you. Thank you, doctor.
Joshi's Kerala group, ma'am. You refer Joshi's Kerala group. Yesterday also I shared that number. Okay. Now next person, Bulbul.
Good evening, sir. Sir, एक पर्सन पेशेंट है जो मतलब उनके जो माइंड है बहुत डिस्टर्ब रहते हैं. पास्ट थॉट्स जैसे आते हैं और फ्यूचर को लेकर भी फियर है, लोनलीनेस. पास्ट का जो थॉट्स है वो बार बार दिमाग में आता है. पास्ट में जो कुछ हुआ है उनके साथ या जो भी है, ऐसा उनके दिमाग में पूरा आता है. फ्यूचर को लेकर भी फियर है और लोनलीनेस फील करते हैं. लाइक वो और लेथर्जी है, मतलब वो कहीं जाते भी नहीं है, घर में ही है. तो 40 एज है, तो वो जानते हैं कि हाँ ये थॉट्स आ रहा है, मुझे इससे बाहर निकलना है. मतलब जान के हुए भी नहीं कर पा रहे हैं. तो इस पे हम माइंड पे कैसे काम कर सकते हैं?
हाँ, ये आपको इसमें ना you have to tonify the gathering chi first. Just do it. Lungs and heart पे tonify करिए, ठीक है? तो ये जो बहुत पुराने जो sad वाले केसेस होते हैं, these sadness, grief, due to past events, the lungs are getting affected mostly, ultimately, which is leading to which will affect the heart ultimately. तो आप थोड़ा सा gathering chi boost up कराइए. Gradually he'll start feeling good, and then you can ask him to do some pranayama or exercise. That these patients can recover.
Okay, sir. Another question is जैसे मेंटल रिलेटेड बच्चे होते हैं, क्या उनको हम मतलब वो रिकवर हो सकते हैं?
कौन से बच्चे आप कह रहे हैं?
mentally retarded.
Yes. We can help them to a certain extent. जैसे CP का patient होता है, the CP patients, they are we can definitely help them to a certain extent. Significantly we can help them, but 100% is not possible.
Yes, sir.
At least at least those patients will be able to live a better life after the treatment. Okay, I'm not saying 100% better, but much better, much better.
सर मतलब ये क्या क्या उनका जो प्रॉब्लम होता है कौन से मेरिडियन पे काम करना पड़ता है या कौन से ऑर्गन पे?
देखिए इसमें आपको ब्रेन पे काम करना है, ठीक है। ब्रेन के लिए जो मेरिडियन है वो गॉल ब्लैडर भी ब्रेन पे जाता है, गवर्निंग वेसल आल्सो गोज टू ब्रेन। सो गवर्निंग वेसल पे तो काम करना ही करना है। गवर्निंग वेसल इज एन एक्स्ट्राऑर्डिनरी मेरिडियन, ओके। वहां पे भी काम करना पड़ेगा आपको, स्कैल्प एक्यूपंक्चर देना पड़ेगा। Along with that, you have to see accordingly that mainly it's governing vessel which we have to tonify, the kidney essence which we have to tonify. So kidney essence banega, so it will go flows up to the from through the governing vessel, it will flow to the brain. Okay. Then scalp acupuncture plays a very important role in such cases. And accordingly you can add some this auriculo acupuncture or ERCs you can also apply. They also have a positive results on in such cases. But it's a very holistic approach you need. Multiple aspects are needed to be done. You have to see each and every aspect. कई multiple approaches चाहिए यहाँ.
Padma ma'am?
Yeah.
Yes,
Thank you, ma'am. Good evening, sir. This is regarding a 20 years old girl. She has a kind of these problems. One is severe acne face and back of the back, and short gap of cycles, frequent kind, 2 cycles kind of.
There are acne. First of all, there is acne, and there is too much gap between the cycles.
Less gap, sir. There is very less gap.
Very less gap.
Yeah. She has acne and short cycles and psoriasis. Psoriasis means not dandruff actually. Kind of dandruff and dry hair. Lot of dryness in the hair. Rough and dryness.
It looks like she must be having a lot of heat in the body.
Heat in the body.
Hello. It looks. I'm not sure without looking at the tongue. I cannot. I'm not sure without. But the age which you are telling me, and the most common reason could be the heat in the body, or the liver heat itself, or the heart heat itself. It could be anyone, and which could be leading to heavy menses or very early menses. Short periods are mostly due to this reason in this particular age. Okay, for a specific diagnosis, I have to see the tongue. I have to take the other symptoms in this particular age. Okay, for a specific diagnosis, I have to see the tongue. I have to take the other symptoms.
Okay.
Hello.
Yes, sir. I'm here. Kind of dandruff, psoriasis, kind of.
Is dandruff or it's psoriasis?
I cannot say. Maybe
If
psoriasis.
it is psoriasis, definitely liver is involved. If it is dandruff or dry scalp, then it could be due to that heat itself. There must be a hair loss as well.
Padma ma'am, you have some problem with your mic. So I think it is better you can contact him directly with the number given in the Joshi Kerala group. Now next chance goes to Mr. Raj.
Hello, sir. थैंक यू फॉर वंडरफुल सेशन। सर मुझे ये पूछना था कि मेरा भाई है, इट्स 55 एज, तो उनको ना सडनली पिछले 6 महीने में 2 बार ऐसे हुआ है कि वो टोटल ब्लैकआउट हो गया, दिमाग में कुछ याद नहीं रहा कि आज कौन सा महीना है, कौन सा दिन है, और आज मैंने दोपहर में क्या खाया था या रात में क्या खाया था, ऐसे 2-3 बार पिछले 3-4 महीने में हो गया है। तो ये क्या रीजन हो सकता है, रिसेंट का भी और 6 महीने साल पहले का भी, कि हम इस घर में कब रहने आए थे, हमको 10 साल हो गए इस घर में रहने को।
हार्ट एंड किडनीज पे देखना पड़ेगा, हार्ट एंड किडनी एक्सेस पे देखना पड़ेगा इसमें।
अच्छा,
मोस्टली सिम्टम्स कुछ वैसे ही हैं। हार्ट एंड किडनी एक्सेस वी हैव टू लुक, मोस्टली हार्ट इज बीइंग अफेक्टेड मोर, looks like that, which is going to affect the kidneys in the longer run.
So it is
excess? Pardon?
एक्सेस होता है तब प्रॉब्लम्स होती है सर ऐसी?
नहीं, heart and kidney axis, I have been teaching you this thing. So heart and kidney axis, when जब ये दोनों organ आपस में बातें नहीं कर पाते ना, तब ये सब इस तरह की problems आती हैं.
अच्छा अच्छा.
इनकी एनर्जी एक्सचेंज नहीं होती. जब हार्ट की फायर नीचे किडनी तक नहीं जाएगी, किडनी का वाटर ऊपर हार्ट तक नहीं जाएगा, इस तरह के इश्यूज तब आते हैं. सो वी हैव टू वो सिम्टम्स देखने पड़ेंगे, टंग देखनी पड़ेगी, वी हैव टू डायग्नोज अकॉर्डिंगली.
अच्छा. और आंखों से ना धुंधला दिखता है उनको दूर का, हालांकि उनकी आई साइट बहुत पावरफुल है और उनकी मेमोरी भी बहुत अच्छी है. उनको 6 साल के थे तब से सारी बातें, जगह, कलर, इंसान, हर एक चीज उसको याद रहती है. और आई साइट यहाँ से हमको नॉर्मल आदमी दिखता है, उससे दूर दूर का भी दिखता है उनको. लेकिन अभी पता नहीं कुछ 2-3 महीने से उनको दूर का थोड़ा प्रॉब्लम होता है. देन 4-5 दिन नहीं दिखेगा ठीक से, फिर 4-5 दिन से ठीक से दिखने लगता है क्लियर.
थोड़ा जो मैंने बताया ना, हार्ट एंड किडनी एक्सेस वाला ही जो मैंने पढ़ाया है, मैं आपको उसी में से उठा के बता रहा हूँ. ठीक है. तो हार्ट एंड किडनी एक्सेस जो है ना, वही कहीं डिस्टर्बेंस आ रहा है, वही में कम्युनिकेशन नहीं हो पा रहा है. दैट कुड बी द पॉसिबल कॉज.
तो ये विजन ब्लरिंग का भी प्रॉब्लम उसी की वजह से है?
हाँ जी बिल्कुल. जब आपस में दोनों बातें नहीं करते तो बहुत अलग अलग सिम्टम्स आते हैं.
अच्छा. एंड अबाउट वेरिकोस वेन?
वेरिकोस वेन्स के लिए तो आपको सिंपली ब्लड सर्कुलेशन के लिए हार्ट पे काम करना पड़ेगा. फॉर टू इम्प्रूव, आई एम नॉट सेइंग द हार्ट चैनल. ओके, हार्ट चैनल की बात नहीं कर रहा हूँ. हार्ट 7 1 2 3 4 5 6 7 वो वाला हार्ट चैनल की बात नहीं कर रहा हूँ. मैं हार्ट पे काम करने की बात कर रहा हूँ, which is responsible for circulation. Okay,
right.
So acupuncture has a wonderful, very good results are there with acupuncture. I have treated cases and it really helps.
अच्छा. Okay. Thank you so much, sir. Thank you so much.
Hello, doctor.
Yep.
Hello. It was a very nice session. Thank you very much. I have two questions, doctor. A 16-year-old boy. He is a cold-bodied person, very inactive, very lethargic, especially because of this online classes and all that. He doesn't feel hungry at all throughout the day. Till about 2 o'clock in the afternoon, he doesn't feel hungry at all. But he's always sweating. In this cold season, he's full of mucus. His nose is full of mucus and sneezing is also there. But the thing is, he's always sweating. What could be the...
I've already told this, that it is due to deficiency. The patient looks like deficiency of spleen, deficiency of stomach, along with the deficiency of lungs. Okay, so lungs are weak, the defensive chi will be weak. So in a cold season, there will be the wind cold will affect the defensive, will attack the body, and the defensive chi will stop flowing, which will stop the diffusing function of the lungs, which leads to sneezing and all these things. So what you need to do is, during the time of cold, okay, during when the patient is having a cold, try to expel the exterior pathogenic factors which has affected him, and when the cold has subsided or the patient has recovered, then try to improvise on the lungs and the stomach part. This should be the procedure for the treatment.
Okay, doctor. And another thing is, feeling thirsty only in the evening, especially in winter. During summer, the thirst is normal, but in winter season, absolutely no thirst during the daytime, but feels like drinking water towards the evening, especially hot water. After getting used to this hot water during this corona season, hot water is more satisfying than the cold water. What could be the pattern here, doctor?
Yeah, there is in the winter season, you are saying, so it could be due to the excess of the cold in the body. So is the patient the same 18-year-old boy?
No. The patient is about 50 years old, but from a very young age, this is the case.
This could it could be due to yin deficiency and empty heat. Okay, it could be. I'm not sure.
She has a
See,
very
the-
dry body, dryness, lot of
हाँ,
dryness
हाँ,
in the body, but she doesn't feel thirsty at all during winter.
हाँ, so it is due to, it could be due to iron deficiency, mostly. So in such cases, we have to now put some needles for to increase the thirst for the patients. Okay, so what gradually you will see there is increase in the appetite, there is increase in thirst, and then the symptoms will start going down. It could be due to iron deficiency, kidney iron deficiency could be the most probable reason.
Hello? Hello?
Yeah.
Hello, sir?
Yes, please continue.
I feel like feel sleepy always. I got my thyroid tested and no problem with that. Whether I eat or I don't eat, whether I sleep well or I don't sleep well.
Excuse me,
I
I'm
feel
not able
sleepy
to.
always.
Your voice is, excuse me, your voice is not clear. Please, if you can repeat.
I'm always sleepy. I feel sleepy whether I eat or I don't eat, whether I sleep early or late. I'm always sleepy and I feel bloated also, doctor. And my skin is very dry and also my knee has pains a lot. But I want solution for the sleep because I feel so lethargic that I'm not able to function properly. Though I have been doing everything at home, I feel terribly sleepy.
So, can you tell me, is your weight increasing, or there is some swelling in your body, or you have a heavy physique?
No, I don't have any swelling. I don't see any swelling. But when I went to the doctor, he pressed near the spleen 6 and he said there is little edema. But outside, I don't feel that and it doesn't even pain there.
Please tonify your spleen first of all. It sounds like that you have a deficient spleen. Tonify the spleen yang. Do some moxa, and do some moxa at GV20 also at the top of the head. Okay.
Moxa for head.
Pardon?
Moxa for head.